Well done. Thank you. Thank you, Amr. It's my pleasure now to introduce Dan Pollard, the founder and CEO at MyDrugCosts, to present MyDrugCosts. Welcome.
Thank you very much. Good morning, Datapalooza. $95 billion. That's how much we in the United States waste every year on prescription drugs. Said another way, we spend this much money without any additional health benefit. Pretty shocking. Why? Why are we spending this much, or why are we making this kind of spend without the benefits? It's because we don't have the information. We're not making informed decisions. We make poor choices on brand and on pharmacy. Now, why are we making these poor choices? It's because the information is confusing and inaccessible. So prescription drugs themselves are confusing. What are the names? Is there available generics? What's the regulatory status? What are alternatives? You mix this in then with health plan specific information. So what is covered? What is not? What's the formula? How much are the copays? So taken together, this information today as it exists is confusing, inaccessible, and very time-consuming to interact with. So to illustrate this, let me tell you and introduce you to the Smith family. This is a typical family of four in the United States. They spend about $1,200 themselves on prescription drugs, and then on top of that, their employer spends another $1,300 to provide those benefits. So just a couple quick examples of 3 drugs that the Smith family bought this past year. First, Mrs. Smith goes to the doctor and is diagnosed with pink eye. She gets prescribed a prescription for Vigamox, takes the prescription to her local pharmacy, pays a Tier 2 copay of $40, and gets her prescription. Mr. Smith, he has high blood pressure and takes a generic drug called lisinopril. $15 a month is his Tier 1 copay. Again, he purchases it at his local pharmacy. On an annual basis, this is $180 a year. Now, the big news in the Smith family this year was Brother Smith had an injury while playing baseball, had to have some knee surgery. And so upon discharge from the hospital, he was prescribed ondansetron to control nausea for post-surgery. They take this prescription to the pharmacy. That was over $300. Definitely a shocker to the family budget. So let me take a step back and show you what happens when the Smith's family employer provides a tool called MyDrugCosts, where they're able to make more informed decisions as consumers. So let me replay the scenario here, and we'll look up Vigamox. And here we see information, plan-specific information about what Vigamox costs on the plan. $40, but I see that I can get a lower cost drug. So in real time with my doctor, and this is available on a smartphone, it's a web-based solution, Android, iPhone, web-based, and I can see directly, here are some different alternatives for Vigamox that can cost $4 or $15. And so together with my doctor, I'm able to make an informed decision about what is the right drug. And so they're able to choose levofloxacin for $15. Let me then look up blood pressure for Mr. Smith. We just look at lisinopril, and we find information there to help us see, okay, $180, but I can buy this through a discount retailer for $40 for the same yearly quantity. And Mr. Smith can be doing this from home, quickly accessing this information. They see, oh, here's my 10 milligram lisinopril that I can get at Target. Click on and access right to a Google map, can see a local Target pharmacy, call up the pharmacy and have them switch the prescription. Very quick and easy. Now, let me look at the ondansetron, which is it's kind of a little bit of the shocker here. $332 for a generic drug. Bit of a surprise, but turns out that there's a coverage issue with the insurance. We can click here and we can quickly see what the issue is. Oh, there's a quantity limit here. So in the case of the Smiths, they were prescribed a quantity of 60, and that quantity was not covered. There's a limit, and this gives us direct access into the plan-specific information where I can see coverage information showing me that only 48 pills is covered by the plan. So making a quick change, talk right there with my pharmacist, I'm able to change that cost from $332 down to my $15 generic copay. So as we see here, we've taken, in just about a minute of time here, I've taken the Smiths family drug expenses from over $500 and I've saved them $500. So a small amount of information, but applied at the right time with the right information, can have a huge impact on prescription drug costs. So how do we do this? What we've done is we've brought together a lot of data from many different sources. We've taken federal data from the National Library of Medicine, from the FDA, to drive the terminology and the generic equivalents and the regulatory statuses of the drugs. And we've brought that together with health plan specific data from the payers themselves and also from employers, giving people direct information specific to their health plan. And then additionally tied in other market data from pharmacies and brand manufacturers to give them a full picture of how they make the right purchase decision. So I ask everyone here to just feel free to come by, join us, and I'd love to show you more about how we are able very quickly to help people make a big impact on their prescription drug costs and really alleviate the $95 billion in waste that we see every year. Thank you.